You are still watching the morning call here on Africanews. Now, measles has killed more than 6,000 people in the Democratic Republic of Congo, the World Health Organization has said, calling it the world's worst and fastest growing measles epidemic. Around 310,000 suspected measles cases have been reported in the DRC since last year, with 25% of them occurring in children under 5 who are most vulnerable to the vaccine-preventable disease. The WHO also added that even though the agency and its international partners have vaccinated 18 million Congolese children, routine immunization coverage is still low across the country. A shortage of funds has remained a huge impediment to efforts to curb the outbreak. Bridget.
The global measles outbreak has intensified in part due to mistrust of vaccines, but the situation has worsened in the DRC with malnutrition, unequal access to health care and insecurity in some areas of the country. At the same time, the country is unfortunately waging a merciless battle against the Ebola virus, which, according to a latest report, has caused more than 2,200 deaths. There also has been an epidemic of yellow fever and an outbreak of malaria. To discuss it, Dr. Vincent Sodjinou, head of the fight against measles for the World Health Organization in DRC, now joins us by phone. Thank you so much for being with us. The epidemic started in 2019. Why is it still so difficult to contain it?
Merci pour votre question. La RDC est un pays très vaste.
Thank you for your question. The DRC is a very vast country, a continental country, which has unfortunately been plagued by humanitarian crisis for several years, as well as security problems that limit the access of the population to certain interventions in the field of public health. In addition, in the country, we have a lot of places that are difficult to access, where many measures and housing means are needed to implement interventions. And on the other hand, we have a health system that has been weak for years and lacks some essential elements of the implementation of public health interventions. In the face of these challenges, the response to the measles epidemic had some problems. We were forced to do the vaccination of children in 3 phases. Plus, we also had a lot of malnourished children in the country, and when measles attacks malnourished children, we were forced to do the vaccination of children in 3 phases, especially because we had a lot of them in the country. This led to complications and therefore many deaths. Finally, the community involvement at the beginning of this epidemic was not at the expected level. The parents did not take their children to the hospital to receive the necessary health measures early enough, and this made the risk of epidemics difficult and caused the number of cases and deaths that we are now deploring.
So recently, the WHO, in partnership with the government, began intensified vaccination campaigns. Has this resulted in a drop in the number of reported cases?
It
must be recalled that since the end of the vaccination campaigns, we have noticed a beginning of decline in cases. Since about 2 weeks ago, the number of cases we were receiving during the week has been decreasing, but the number of cases reported is still very serious. On average, 5,000 cases per week. So the government has just approved a new strategic plan for the next 6 months, and this plan includes a number of innovations.
Et ce plan prévoit certaines innovations.
The first of which is to extend vaccinations to children aged 5 and above, from 5 to 14 years old. Secondly, we will add the treatment of malnutrition to the treatment of measles. and also treat other diseases that can occur in children with measles. And finally, we will strengthen the health education of children's communities that parents send their children to the center very early to receive the health care that they need. So how do we deal with the issue of health workers being more skilled in containing the epidemic?
J'avais dit tout à l'heure que le système de santé du pays est faible.
I said earlier that the country's health system is very weak, and this weakness includes not only weaknesses at the material and logistical level, but also in terms of staff numbers and skills. And that is why, for the past 2 months, the government has been deploying experts, pediatricians, and actors from the central level of the health department to train health center actors on the management of simple cases and also the recognition of serious cases, and finally, to refer them very early to hospitals for treatment. Measles is a preventable disease through immunization, and the very first step we recommend to communities is to vaccinate children. The government has just adopted a strategic plan for the next 6 months, and the World Health Organization calls on all donor partners to support the government by mobilizing resources to enable the implementation of this plan.